Great. Thank you, Selby. And thanks everybody for joining us today. This is one of 8 in a training series we're calling the System of Care 101. Today's training is going to be on special education and 504 services. Just a couple of quick housekeeping things. We're being recorded. We're asking that folks stay on mute throughout the training. We're going to do 30 minutes of presentation and then about 30 minutes of questions. During the training, feel free to drop questions into the chat and the presenters will get to each of them either during the training or they'll go back to those during the Q&A time. Just want to share a little about System of Care. We are a regional cross-system collaboration of youth, families, and system leaders who are working collaboratively to improve the services and supports available to children, youth, and families in our region by building and funding a true system of care model in a Tri-County region. So this System of Care 101 series is one project meant to address a barrier around perception that it's difficult to learn about all the different systems in the first year of your job. And so we were thinking, let's roll out something that everybody can take a look at. So these are being recorded so that you can go to our website and watch them later if you want, or share them with colleagues or new staff as they come on board. We support multiple meetings each month to address barriers. We try to ensure that services are well coordinated, culturally, linguistically responsive, youth and family driven, and community based. And then just to see if I can find the notes here. Okay, so this is our website. It's www.systemofcare.net. And on there you can find a tab at the top that I think says training resources or something of the sort, navigation resources, I can't remember. But that'll have text that'll provide summaries of each system. It'll have links to different helpful resources on there, and then it'll have the video for the trainings on there as well. And so we're hoping this is a great training resource for you all. It's also a link or a tab at the top that says barrier resolution, and you can click that to submit a barrier. So if you've seen something that you think is really getting in the way of youth and family being successful, you can put it up there and our wonderful groups will take a look at that and see if we can support addressing it. And that's about it. I think I want to pass it on to Elaine and Joni to let them do their great training here. So thank you.
All right, thank you. So Selby, thank you for presenting our slides. We'll wait till they pop up here. Thank you everybody for being here today. We're excited to be able to present to you about special education and Section 504. My name is Elaine Fox and I'm the Executive Director of Student Services at Hillsborough School District. I've been doing special education for about 25 years and I've been at Hillsborough for about 12 years now. And I am honored to present with Joni, who is from Multnomah Education Service District. And we're hoping that Michael Salator can make it, but we're not sure. Either way, we'll continue on through our presentation and we'll go ahead and get going here. So Selby, would you mind switching there? Perfect. So we always start off, particularly in education, with just our objectives of the presentation. And so today we're hoping that you will understand the difference between special education and Section 504. There are some overlapping similarities, but also some really important differences there. And then we're also hoping that you understand special education and 504 processes from an evaluation standpoint, which is a little bit different, and also the development standpoint. And parents will be aware of resources and processes to access support for students experiencing a disability. So we're really hoping that this covers some resources that are useful to you. All right, we'll go ahead and switch. So the first thing that we like to start off with here is really if you have concerns about a student, whether you are having concerns from a professional point of view or whether you are a parent, there's some really good places just to start. And this is actually a very common question that we get is, where do we start when we have concerns? And so if you're in an elementary school, really the best place to start is with the classroom teacher, the school counselor, or an administrator in the building. And you could possibly talk with the case manager as well if you're aware of who the specialist education case managers or 504 case managers are. Oftentimes in a 504 plan, the case manager is the school counselor. Oh my goodness, my screen just did something weird. Okay, there we go. For middle and high school, it's very much the same thing: classroom teacher, counselor, administrator, and potentially a case manager. Okay, next slide, please. Whoop, there we go. All right. So there are a few very important differences between IDEA and Section 504. And the first thing to know is that IDEA stands for the Individuals with Disabilities Education Act. And then there is, so that is the cornerstone law that special education relies upon. And almost everything that we do in special education is under the category of IDEA. It's been revised several times throughout the year. The last one, however, though, was in 2004, and we are expecting a revision sometime soon. Section 504 is actually Section 504 of the Vocation and Rehabilitation Act of 1973. And so that is a civil rights law, and we'll be talking a little bit more about that. But some important differences is that IDEA, which is the law that special education functions within, receive state and federal funding. Parents and school districts have due process rights if there should be a dispute. Students meet the criteria for 1 of 10 disability codes at least. There are multiple codes, and they are things like hearing impairment, orthopedic impairment, specific learning disability. Those are just a few. Students require specially designed instruction, and so that means that students need to be instructed in some very special way that would be other than the way everybody else is receiving their instruction. And IDEA has some very important disciplinary protections that protect students who have IEPs from being expelled or disciplined inappropriately based upon their disability. When we get over to Section 504, there's a little bit different set of criteria and rules to that. And so Section 504 has no federal or state funding that is attached to it. The Office of Civil Rights actually oversees Section 504. And so that's a little bit different than IDEA. Students that have a disability really are, the criteria for 504 is that it limits a major life activity, and then a medical statement that about a disability or that the student possesses a disability is very helpful in that process. Students may or may not need accommodations when they have a 504 plan, and there are very similar discipline protections to for students who also have discipline protections or very similar to the ones under IDEA. So there are both discipline protections for students under IDEA and Section 504. I think that those are probably the major pieces that are helpful for you to know. I think another thing is that probably one of the most common forms of 504 plans that we write in schools are for students who have conditions such as diabetes, that's insulin dependent, where they need to go out and perhaps leave class to receive their insulin, get a snack, that sort of thing. And then many students on 504 plans also have a diagnosis that falls under the category of something like attention deficit hyperactivity disorder. So those are two very common areas of 504s. Okay, let's go on to the next slide, please. So if the parent and our school team continue to have concerns after implementing interventions, what happens next? So what happens when we express a concern about a student to a teacher or to a staff is that we try and implement a number of interventions, and we try and say, okay, we're going to try and maybe teach you a little bit differently, or we're going to try this other strategy to use in order to have students really be trying to engage them in a way where we don't need to place that label on them and potentially have a special plan for them. Sometimes students just really need a little bit different strategy. And so we try and do that. If we do that for a while and that is not successful, then we can make a referral to special education, and usually that's for a potential evaluation, or it's a referral for a 504 plan. And that can happen after trying interventions to see if they're successful, usually for about 6 to 8 weeks. And the governing body of that process is usually called the student study team. In different buildings, it's called different things, but the student study team's job is to have a team where they really assess what is happening with those interventions. They're looking to say, hey, have we implemented these interventions? Should we try other ones, or should we go ahead and make a referral for evaluation and have this student evaluated for some different things to see if a disability may be present? Okay, we're going to go ahead and go on to the next one. Okay, so we're going to focus right now on IDEA. So Selby, it's okay. We can move on to the next one, please. Thank you. Whoops. Are we on the right one there?
Should I look? I was looking for one that said IDEA.
Okay, you're right there.
Oh, there. Sorry. Thank you.
Okay. Yes. So for referral for special education evaluation, usually the parent or the guardian will be contacted by a staff member to review the academic and behavioral concerns and try and understand why somebody would want a special education evaluation. Somehow there has been a suspicion that there's been some sort of an issue, but hopefully interventions have been tried. We've tried to work on seeing if students are responding positively to those interventions and seeing if it's necessary to move to this step of a special education evaluation and potentially an IEP plan, or is it not necessary? And so that can happen through the school staff and through that process, or it can happen through the parent and guardian process. And so a referral or a request for special education evaluation can be made by just about anybody that knows the child and has knowledge of what's happening with them in school. And then that SST team typically will get together and they'll discuss the suspected areas of disability and the areas that could possibly require specially designed instruction, and really try and make a good plan for comprehensive evaluation. And that's typically called an evaluation planning meeting, which is a required part of the process by law. Okay, moving on to the next one. Thank you. There are no evaluations that can occur without parental consent. So special education staff will go ahead and provide the required assessments based on whatever the eligibility criteria is that we're looking at. And so different evaluation teams have different philosophies. Some teams like to start very broad and narrow down, and sometimes only a very narrow set of assessments is required. It just kind of depends on whatever the concerns are of both the team and the family. And so as far as the assessments themselves, they can include, but of course are not limited to, in-person testing, and there can be some things like rating scales. They will look at the intervention data. There will be some in-person, hopefully, or right now on Zoom, potentially, observations. The IEP process does require a medical statement. There may be a hearing screening and vision screening involved, and there's almost always a file review involved to see if there's any sort of history that the staff and students need to be aware of. And the special education team, once a consent is signed for evaluation, has 60 school days from that date where it's signed. So that means that spring break, winter break, summer, weekends, holidays, all those things are not counted. So the 60 school days can actually get to be quite long for parents, and that can be frustrating sometimes. So you may hear about that. That gives the school psychologists and the school team adequate time to work through all of those assessments and interventions if needed. All right, let's go ahead and go on to the next one. After all that process happens, the team will contact the parent or the guardian to schedule an eligibility meeting, which will take place no later than 60 school days. So the evaluation generally wraps up within 60 school days. The school psychologist or whoever is doing the evaluation generally produces a report, and then a meeting occurs that includes the parent and the guardian, the classroom teacher, special education staff members who completed the evaluations. And so sometimes the school psychologist will be in charge of it, but they might send checklists out to the student's teacher, parents, that sort of thing, to try and get that input. And then always at an IEP meeting or an eligibility meeting, there's somebody called a district representative who is required to be there. And that person really needs to be able to allocate resources and make decisions for what services are available, where they occur, those sorts of things. So it definitely is a team process, but there are required members of that team. All right, I think we can go on to the next one. And then what happens if your student is found eligible? So either the day of the eligibility determination or no longer than 30 calendar days following that eligibility determination, the individual education program team or the IEP team will convene to draft an IEP for the student. So typically what happens in this situation is that the case manager or the potential case manager will draft an IEP and either send it to the parent in advance, ideally, or bring that to the meeting, and then it's just in draft form. So it's just kind of a starting place, and then the family and the team can kind of work through the things on that IEP and change them or tweak them, or go ahead and go with them if they seem accurate. And so really important to just kind of understand what the general purpose of an IEP is, and it's to set reasonable learning goals for a child. And it's also to identify the services and supports that the school district will provide for the student. So what an IEP is not is a lesson plan. It really should focus on what skills and goals the student needs to learn, and then also really looking at the supports that are required for the student to learn appropriately. So again, there's required members of the IEP team, and you can kind of see them in a list right there, but they're the parent or the guardian. Always a general education teacher is required to be there. There needs to be the special education provider there, who oftentimes is the case manager, but not always. There needs to be that district representative there who understands the process and who is required to who is able to allocate resources. Anyone else the parent chooses to involve. And one more thing that I want to add to this is that in an eligibility meeting, where we're first looking at if a student is actually eligible for special education services, there needs to be somebody in the meeting who's knowledgeable about the evaluation data. So if the parent has any questions, those questions can be answered. And sometimes that can be the case manager, but oftentimes it needs to be the school psychologist, particularly if it's been a very complex, long evaluation. Okay, moving on to the next one, I think. All right, and what will the IEP team discuss in the meeting? They'll discuss the strengths of the student. Parents and guardians will share information, concerns. The parent input of the IEP is probably one of the most important sections, and we oftentimes spend the most time on that. It often will talk, well, there's a mandatory part that talks about the present levels of academic achievement and functional performance that the student is experiencing right now. And that kind of talks about how the student is currently doing in school and how the student's disability impacts their involvement and their process in the general education curriculum. The IEP also has very important annual goals for the student, what an IEP team thinks the student can learn in a reasonable amount of time in a year. These are not super lofty goals that are long-term that would be accomplished over a huge long period of time. They really need to be looking at the current school year. And the specially designed instruction, otherwise known as SDI and related services, is in there. And we talk about how that's going to be provided to the student, what supports, aids, and services are needed in order for the student to learn those pieces. And then there's also an important section about how much of the school day the student will be educated separately from non-disabled children or not participate in non-academic activities such as lunch or recess. That's kind of a weird way of writing that, but really what that means is how much of the time does a student spend with typical students, typical peers in typical settings, and how much of the day is spent in a very segregated, separate setting. That's what that section is designed to delineate. Okay, moving on to the next one. And then what will the team discuss? The team should discuss how the student will participate in state and district-wide assessments, including what modifications to assessments the students need. And then it will also talk about when services, accommodations, and modifications will begin, how often they will be provided, and where they will be provided, meaning are they provided in the typical classroom, are they provided in a very segregated setting, and how long they'll last. And then also, it's very important to note that the parent is a key person in the process, and input throughout the process from them is critical. So those are some pretty key points, and I think we'll move on to the next slide now. We'll just hit, Joni, am I on yours yet or not quite yet?
You're fine. If you want to go ahead and do this, yeah, that sounds good.
What? Why don't I do LRE and then we'll switch over to you here.
That sounds great.
Okay, so one very important cornerstone of special education is this idea of a least restrictive environment. And the least restrictive environment, or LRE, means that a student who experiences a disability should have the opportunity to be educated with non-disabled peers to the maximum extent appropriate. And when we're talking about the idea of inclusion in general and special education, and when we're talking about the idea of being with typical peers and having typical learning opportunities, this is really the key component to that. This is also a hotly debated term that means different things to different people. Districts interpret it differently, courts interpret it differently. And so this is something that the IEP team really needs to spend a lot of time on and discuss. Okay, I'm going to pass it off to Joni now. Thank you so much.
Good afternoon, everyone. I'm Joni Tolan. I am a student services representative from Multnomah ESD. And I've been working in special education for 24 years and also am licensed still as a school psychologist. So this is kind of my cup of tea. Elaine spoke about the least restrictive environment. And one of the things that we do in special ed, so I apologize, is that we tend to have a lot of acronyms, and you'll hear those throughout. I'm not sure if I adequately explained earlier, but an IEP is that individual education plan. I hope that, that I got that earlier. On this, the continuum of placement is that our goal, as was mentioned in the last few slides, is for every student to be as close to the general education peers as we possibly can. So on this, you'll see that at the top of this upside down triangle is a general education classroom without the need for supplementary aids or services. Next is those students with that have needs that can be supported, can still be in that general education classroom, but they might need some additional supports, such as possibly being closer to the teacher or needing extra time to complete assignments or needing special support in some way. Third that you'll notice is that general education and special education pull-out services and supplementary aids. And those are areas where we might have students either in a pull-out method go to a separate room, a resource room, to get some extra supports for on an IEP. Or sometimes we even have SPED teachers come into that classroom, or related services coming into a classroom. Next is when a student is unable, for the majority, to be served in a general ed classroom, they might need a specialized classroom. Often those are our behavioral classrooms. We have a lot of different reasons for that. Functional living skills. There's a variety of different reasons that we have classrooms dedicated just for special ed. Often those children still have access to recess and some specials, but primarily much of their academic education is in that classroom. Next on that list, and it's a very small number of students, are students that require a separate special school. And then when all those are not available, home instruction is our opportunity of least resort. We would prefer that they never have that, but sometimes that can happen. Occasionally that has happened if you have a child that has just an extra variety of needs that cannot be supported in a school with their peers. Next slide, please. Placement determination is made by that same group on your IEP team. That does include the parents that are knowledgeable about the student. It includes someone that's knowledgeable about the evaluation data. That could be a school psychologist. It could be another related service provider, and it indicates placement options. That continuum of placement options that we just talked about is always available to meet the needs of students with disabilities for special education and related services. And I mentioned those before, what those look like. But generally, those are always discussed with every student on an IEP. And then the team determines which is the best placement for that child. Next slide, thank you. The timelines for student review. When we're looking at eligibility, that's reevaluated every 3 years. Does that student experiencing disabilities still need to be served in special education? The meeting participants under that include the parent or guardian, the general education teacher, the special education provider, the district rep, and specialists if they're providing a service or if there is a concern that hasn't been addressed yet are also included. That might mean that your speech and language therapist or your occupational therapist, behavioral consultant, people along those specialties are often included when a student has that need. An IEP is reviewed annually. So every single year, minus 1 day, we have to, by law, at the very minimum, have another look at that IEP to see how is the child done on their goals, what can be added or taken away, where are they at on their progress in reviewing those goals. Always, amendments can be considered at any time at the request of the parent or the guardian or the staff. And amendments are when we think possibly a child's met that goal and we're looking at another goal to include, or we need to switch the location. There's a variety of reasons we use special education amendments. That same group of people is also a part of amendment processes as well. We're going to switch gears for what happens if a student is not eligible for special education. Let's say that we've gone through the process and the child has a disability. Let's choose attention deficit with hyperactivity. That student might be referred. He doesn't necessarily need specially designed instruction as is required under an IEP, but they still have a disability that has been documented medically. The student may be referred for consideration for a Section 504 evaluation. And the word 504 is just what the law is under in our federal law. If the student does not have a documented disability, they'll continue to receive intervention services through general education. So that might mean that they're eligible for social skills groups, or there might be additional services the school can provide for intervention in a regular setting. Section 504 of the Vocational Rehabilitation Act of 1973 indicates that the key word with Section 504 is a word called access. How is the child able to access their education? And who would be present at that evaluation to determine that? Included in that are the parent or the guardian. Usually the counselor is included in that, the classroom teacher or teachers if they're in middle school or high school. And the team together discusses the student's documented disability and discusses an evaluation that might be required if needed. That could include file reviews, observations, concentration checklists. For those of you that are familiar in that medical background, that could be a behavior assessment scale for children, a BASC, or a Conners checklist, or other checklists. Outside evaluations and or any special education evaluation results. Written parental consent is required prior to any evaluations that are being conducted.
And Joni, if we want, we can, Michael was able to make it, so he's here.
Oh, excellent. Michael, it's great to have you with us. So for everyone else that's listening, Elaine took some of mine and I'm taking over Michael. So Michael, I'd be happy to share yours. I'm on slide, as you can tell, my eyes,
19.
19, perfect. Michael, would you like to pick up this slide and the last couple?
Oh, sure. Be happy to do that. Hi, everyone. My name is Michael Salvatore. I'm the director of sport education at a district in South Clackamas County called Molalla River School District. I've been there for this is my 7th year in this position, and like Joni, I'm a school psychologist by training. So a lot of this has deep roots with us, and I'm going to challenge myself not to use any acronyms on this. Before we get into the process around 504, I had a thought as Elaine and Joni were speaking, and that is something that you might find challenging in your different arenas. I'm imagining that in our audience, there's a lot of folks from DHS, coordinated care, care coordination folks so you're working with youth and families and you're navigating systems, and that's kind of the whole point that we're all here. Something that came to mind and is in this slide is that word parent or guardian, and something that sometimes can come as a shock to in particular folks that work for the state when a child is in custody. We in schools, we have to follow the OAR definition of parent. And that definition of parent, frankly, it does not include DHS, even if the student is in state custody. And I just wanted to highlight that. And I think I can work with Brian to get that information out to y'all, what that ORS reference is, because it is obscurely in under Division 15, I believe, in the administrative rules, and so really it's about so if a student is a ward of the state or in state custody, it's whoever the child is living with, and if that's in dispute, or if there's ways for us to identify who that parent is. On the flip side of that, releasing medical records, that is where the state representative would sign off on releasing HIPAA protected information or signing medical releases. So I know that sounds really confusing, but I just want you to know that that oftentimes parent is a broader term that may or may not be come up in a way that makes sense in the world of education. So I wanted to point that out. And getting back to this idea of access, and Joni, I really appreciate that you brought that up. 504, the history behind this, even though the law came in place in 1973, the history of Section 504 goes back to World War II vets coming back and not being able to access, and so this federal law that's really sort of part of the ADA. Is set up to say anyone. It's not just children in school, but employment situations, any type of formal arrangement where it's a non-discriminatory piece. It says we can't discriminate against people with disabilities, and so so carrying that over into school. The process is similar to what Elaine and Joni described in terms of special education. We do an evaluation, we assess, we identify barriers, and then we make an offer of accommodation that really allows for that access to happen. And Joni, I really appreciate that you brought that up, because it is all about access. Whereas with special education, it's about building skills and instructing. to ameliorate the effects of a disability, whereas a 504 is about how do we provide that access. So to the slide, the Section 504 evaluation meeting, and the words are a little bit similar to special education, but I want to hang our hat on the idea of a determination. The team needs to make a determination of eligibility. So in the slide, so it kind of talks about, and Michael, I see your question in the chat. Michael, if you wouldn't mind, can you maybe share what your role is so I can really target your question? That's okay, because what's your okay? So you're a mental health provider. That's great. So the idea of and the language in this has always been really interesting to me. In 504, and my colleagues will correct me if I'm off on this, but placement is kind of the whole package when it comes to 504. The language in 504 is that placement sort of encapsulates the whole offer of services, whether it's a service or an accommodation, but placement sort of generally refers to as that option. Joni earlier in the presentation described a continuum of placements in special education. 504 is a little bit different. There are some exceptions, rare exceptions, like 0.01%, I would say, where a 504 could drive like a separate school if a child didn't identify or didn't qualify for special education. I know that I think there's like one, maybe at Serendipity Center, that has kind of had, because that one student is there that's on a 504, is creating a lot of interesting dynamics within the service array. But it's both. Placement in the world of 504 is where that's going to take place and what that service looks like, and the team makes that determination. So getting back to the slide, in the slide talks a little bit about a process. In 504, the language, and even in the federal law, is really it's vague. It kind of lets local programs sort of define how they do that business. The same process. We have a concern. We come together as a team. We want to do some level of assessment to identify the barrier, and then we want to, in that assessment process, we want to get consent from parent. And again, going back to that definition of parent, who's allowed to give that consent matters, and we in schools follow the OARs around that definition. So again, parent, guardian, teacher, or someone knowledgeable about that child. Counselors are typically the folks in school districts who case manage and lead that process. And so that team would make a determination around the 504, and if it is determined that they meet the criteria under 504, the team is going to discuss what are those accommodations, what is that offer that the district is going to make to the family. And for this decision, they need to consider other mitigating measures. Like, for example, Joni used the example of ADHD. If the student is on medication, we've got to consider that. So if a student has ADHD or ADD and is taking medication, do they really need that a level of support? And so that's a question that the team would need to determine. Could I ask for the next slide, please?
Michael, just quick time check. I think we're going to leave about 25 minutes for questions, so we've got to wrap up our.
Great. Yeah, this is short and sweet. I love it. Less is more, right? And so we do like to review those plans annually. We want to have the parent and other key stakeholders. If you're a DHS caseworker, if you're a care coordinator, if you've got a stake in this child's world, I'm kind of wondering if there's any CASAs that are court-appointed special advocates that are also in here. I would say to partner with parent and ask if you can be invited into this process. School is oriented to reach out and work directly with parent. And so if you're in one of those other stakeholder support roles, even though you're not a required member of that team, at least from my view, and I know a lot of the colleagues that I work with, we always want to welcome those stakeholders into those conversations to be a part of that process. Because oftentimes, boy, when we're dealing with multiple agencies, it always helps. And so eligibility is reviewed on a regular basis. In the slide, it says 3 years. We can do that more frequently if needed. Is there another slide behind this one?
Yes, this is talking about FACT.
Okay, great. So that's I would say that the key takeaways for you to remember on Section 504 is that it's all about not a system not discriminating against an individual who has a disability. There's lots of ins and outs and specific pieces around that, and I certainly couldn't cover that in 5 minutes or less. So I would say your point of contact typically is going to be your school counselor of the child that you're working with, and if you're not sure, there is always a school principal. And even though they may not return your call immediately, they're responsible for all of those services in the building. And I think it's safe to say they're going to be your most reliable point of contact if you're not sure. Thanks so much.
We should probably spend just a minute talking about FACT here, just because FACT is a really important organization. So I just want to mention Families and Communities Together is the primary organization in Oregon that is a parent resource for any student or child who is experiencing some kind of disability, and they provide free information, free training, free seminars. They will come out and work with districts. They will give parent presentations anywhere, including non-school districts. So they will work with DHS, they will work with other organizations to share information. And every state is required by the federal government to have a parent training and information center, and FACT is Oregon. So it's statewide, and it is partially federally funded because it's required. So just keep in mind FACT if you need a resource for any parents or guardians working with a student who experiences disability. And you can also get on their website, which is terrific, and has all kinds of resources on there. All right, next one. I think we might be... Go ahead, Selby, and go to the next.
That is slide 21 of 21. You are
perfect.
done.
All right. So I know that was a lot of information in a very short period of time, but if anybody has questions, we are more than happy to answer those.
I'm working on finding the ORS reference for the definition of parent. I think that'll be really helpful, and I will drop that whole definition in the chat with the ORS reference.
All right, and maybe while people are thinking of a couple of questions, I wanted to just mention something about the idea of accommodations and modifications in school, because this is a very confusing concept to even a lot of our teachers right now. And we can put modifications, meaning the student's instructional program is actually totally changed. So maybe the standard or the expectation for what actually occurs in terms of work completion is totally different than it might be for other students. An accommodation is really more if we are just kind of adjusting the student's setup to learn. So maybe if they have attentional challenges, we're putting them in the very front of the class, or maybe we're giving them frequent breaks and that kind of thing. And it's a really important thing to know the difference between the accommodations and modifications when we're in these meetings as professionals, because when we're modifying a student's program in high school, that can actually result in a different kind of diploma, and they can get a modified diploma as opposed to a standard diploma from high school. So it's really important, if you're ever in a meeting and you hear that word modifications, you really want to talk more about that to make sure that we're not unintentionally giving a student a different kind of diploma than they were planning on. So that's just one little piece I wanted to pop in there. I see there's a question here. Let's see, are there resources for parents if a child isn't in school, whether preschool age, in an unstable living situation or homeschooled? That's a great question. Michael or Joni, do you want to tackle that, or do you want me to?
In Multnomah County, I can add a couple pieces to this, Elaine. In Multnomah County, we at MESD oversee the homeschooling piece for the county for students that are registered in homeschool. And so there's resources and documents that are available for families that need that. And I can include that phone number and the person in charge of that, Brian, if you want, for notes for you. There also, I'd like to mention that we have preschool, because you're looking at all different ages. There are preschool programs such as early childhood and early intervention that are available for families. And then there are also other avenues that are available that we can use for the general education population in Multnomah County. And we have access to some of those resources through the counselors at each of the elementary schools.
I would say it's a very similar setup for Washington County. I would say that so Northwest Regional Education Service District serves our preschool students. So they do both early intervention and they do early childhood special education. Then early intervention is 0 to 3-year-olds, and early childhood special education is 3 to 5-year-olds. And they have programs for both of those. They receive referrals both from parents or guardians directly, and then they also get several of them through the pediatricians. And so that's probably the two most common sources of referral, although almost anybody who knows a child can initially refer them.
Michael has also put in the chat room the information he was looking at regarding the law on guardians with DHS. I believe that's what that documentation is, right, Michael?
I was unable to cut and paste a section, so I just dropped the whole special ed OAR in there, and it's up at the top toward definitions.
Great.
So, and you'll find some other interesting information in that OAR. A lot of us use that as a frequent reference point.
Another question that was asked by another Michael was, who chooses the accommodations and modifications in an IEP? And generally those tend to be suggested by the special education teacher, but it's very common, and it happens at almost every meeting I've ever been at, that parents have additional ideas on ways to support children, on ways to help make that child's education successful. So there is a consensual agreement on what can help this child. And so the team together can make those calls.
All right, and we have another question that is, what is the criteria for a student to have home placement, and what supports does the school provide? Great question. So I guess the first question is that we have a couple different kinds of things that happen at home. So one is home instruction, and different districts have different kind of the practices vary a little bit. I can tell you in Hillsborough School District, we have home instruction that occurs, well, right now it occurs if a student has COVID, and we're doing mostly everything online anyway, but the home instruction placement typically will happen if we have a student who is maybe waiting for an out-of-district placement, like maybe they're waiting to get into treatment and there won't be a slot for a few more weeks. And so they can't really be in school due to safety reasons or other concerns. And so their placement is just home instruction kind of in the interim period. And the services typically that happen there are much more minimal than they would be in the building. They usually occur for about an hour a day, and they have one-on-one instruction with the certified teacher. And so it doesn't look quite as comprehensive as it would look in treatment or actually in the building. Michael and Joni, I don't know if you have anything that you'd like to add to that.
Yeah, I'd like to chime in on this. One thing I think a good guiding principle to keep in mind is that the IDEA and the federal laws around students with disabilities and those services are predicated on parents enrolling the child in the public system. the moment the parent makes a choice for homeschool, for example, and Joni in Clackamas County, our ESD also handles the homeschool selection. And there's some confusion around this because a lot of parents will think if they get on an online charter school, they think that's homeschooling, and it's not. I would say the guiding principle is around the obligation of FAPE, free appropriate public education. And the FAPE obligation, when a parent chooses homeschool or a private school, their entitlement lessens. They don't have the same kind of due process rights as they would as if they had enrolled their child in the public system. And so for a homeschool situation, from the federal standpoint, the IDEA would say the school district has no obligation, and we would send a stand ready that says a notice that says if you re-enroll, we'll serve your child. In Oregon, we have an obligation to offer an IEP to consider. I want to use that word consider. It's a legal term. Does it make sense for us to offer services as a school district in conjunction with a homeschool program? And if it doesn't make sense, the district holds the legal authority to say, you know what, this is not going to work for us. We're going to decline. And we can refuse that with having good legal standing. The private school situation is a little bit different. So we have, if there's a private school that resides in a school district, in Molalla, we have Country Christian. And so if there's a student that is attending Country Christian, because Country Christian is in our attendance area, we have what's called the child find obligation. And we also have a service obligation if the child is eligible and the team would like to access those services. But yet, as I said before, they don't have the same due process rights as if they were to choose the public school option. And so if a parent is saying, I'm gonna have my child attend a private school, and we suspect there's a disability, then we will move forward as a team and move through that same evaluation process in special education. And if the determination is that they're eligible for services or that they do have a disability that requires specially designed instruction and there's an impact to their education, then we can offer those services, but it's not on an IEP. It's or an individualized education plan like it would be in a public school. It's generally referred to as a service plan. And those service plans I would almost refer to it as like IEP light. The parent can't come in and demand and say, I'm entitled to these services. It really is a negotiation process. And it usually happens within the public school, and the parent has the obligation to transport. So I think a typical example would be there's not usually speech services in a private school. And so a parent, so if a child has a communication disorder, for example, and needs some speech services, they might come over to their neighborhood school where they can be included into some speech services, and it really is about a negotiation. So I think that those are a few things that I want to highlight to answer that question.
Well, and also I want to circle back too, because we have two different things we're talking about. One is home instruction and one is homeschool and one is private school. So it's actually three different things. Home instruction is the piece that I was speaking about, where you have an hour a day of very direct one-on-one instruction. That's usually a temporary situation. That's like an interim placement. Michael did a great job describing private school and what the obligations there are around a service plan, and then also discussed homeschool, which is where a parent enrolls in usually the education service district and decides that they are going to just teach a student at home on their own. So those three all work very differently, and those are three different situations, but they all have parts that occur at home. So just to kind of clarify between the three. And we're happy to talk to anybody more about that has those questions, because it is, unfortunately, in special education, infinitely complicated. And so trying to make it understandable sometimes can be a challenge. So we're happy to discuss more if needed.
Good point.
How can a parent obtain translated IEP in their language? So that process very likely works differently in different districts. In Hillsborough School District, if a parent asks, they can have it. So it's a very simple process there, and we automatically do it for families who typically we have a huge Spanish speaking population in Hillsborough. And so we have many, many IEPs that are translated, sometimes even written in Spanish to begin with. For most of our other languages, upon request, we translate into any of them. We just usually have to send that out to an agency to translate it and then provide it to the parent.
And I'll say, and I appreciate the dynamic that Elaine brought up, is that school districts operate under local control, and so they operate very differently. Although a lot of the rules are, we all have to follow the same rules. So in our district, for example, we're much smaller, so we have one translator who works for us. And so if a parent requests an IEP translated into Spanish, what I will do is I will offer them to participate in the IEP process with the translator. What I don't have is the bandwidth to translate the actual IEP into other languages. And so, and I think that's a common practice in smaller districts for districts like Hillsborough that have, a few more layers of services available. That's something that they're able to do, but we're not. But we're both still following the law on that. Meaningful participation is the key piece there.
All right, and there is a set of required documents that everybody is required to translate that I know Michael does too, and Malala. So when we have like an eligibility document, that's one that is actually required to be translated by everybody. Strangely enough, the IEP is not necessarily under the required translated list, which is somewhat odd, but for whatever reason, that's just not the way the law is written right now.
One thing that might be helpful to those that are on this call is that ODE does have a list of documents that are translated already that are some of our most common lists. And then the other piece is that often we have had success with using Google Translate with Synergy and then having someone edit, similar to what Michael mentioned with a translator, edit that final version to make sure that the language translation came through, which is a little less expensive. But that's kind of how we've done it in Multnomah County. But there are documents that are already translated at the state level that we have had access to as well. And that's on the ODE website.
All right, we have one more. Do we have time to look at the last question, Brian? Yeah, okay, thumbs up. So when I worked at a school district in Marion County as a translator, they automatically sent it to me to translate and then sent it to the parent. That's a great process. And so, and it's very true what Michael mentioned, that bigger districts often have even translation departments and a little bit more capacity. I know when I was the director in Banks, we definitely didn't have that. And it was much more challenging to get everything translated. So the process does vary from district to district just a little bit.
All right, maybe we'll stop there.
Sounds
And
good. Thank you.
yeah, thanks so much, Elaine and Joni and Michael, for all your work to create this presentation and for being here. It was incredibly informative. I think the lack of questions maybe spoke to the thoroughness of the presentation. So thank you so much for all the detailed information. And this website, or this video will be up on our website so people can refer back and learn more. And you can see Elaine put her contact information there. Reach out to me, go through our website to contact us, or reach out directly to Elaine or Joni there if you have questions you want to follow up with. So thanks everyone for joining us.
Thank you so much.
Thanks for having us. Appreciate it.
Thanks, everyone. Keep up the great work.
Thank you, Selby.
Thanks.
Thank
Sylvie.
you.